CDC has an vaccine advisory panel, as I understand it, that has just voted to remove the recommendation that all newborn infants receive the Hep B vaccine.
The long-term impact is going to be incredibly terrible. This man is a true menace to our public health, and he should resign or be fired.
Dr. Jeremy Foust, I am so happy to see you. How are you?
I'm doing as well as possible, Jess. It's great to see you too.
I know it's always a hard question to answer these days. Well, I want to say I am very grateful to you and for your work. I hope you feel the appreciation so many people have for the work you're doing right now. Are you?
That helps. I get little text messages from people that I used to think were like public health and medical gods, and they're saying good job, and that makes me feel good. And then I'll hear from my readers, so that's really helpful too.
Good. For anybody who doesn't know, Dr. Jeremy Foust is an emergency medicine physician, a public health expert. He has so many titles. I'm not going to name them all here, but you should at least be very aware of his Substack called Inside Medicine, where he writes exclusives on health organizations like the CDC. He explains what is really going on inside our health institutions with RFK at the helm, and he is breaking news. So he is really helping to drive awareness about what RFK is doing, even though other RFK is working to keep that quiet. So this is why I'm thanking you, and I know that's why you're exhausted. And before we get into the news, please tell me you're taking a break for the holidays.
Yeah. We will travel. I don't know if I'll stop working.
You should.
But at least there will be no clinical work. So I do work.
Okay.
I work clinically half time, and that stops for a good couple of weeks.
I know. I'm always so amazed when I text you when I'm in LA and it's like 3 a.m. where you are, and you get right back to me. I'm like, when do you sleep? Okay.
Yeah.
Let's talk about the news. Today is a great day to be talking because the CDC has an vaccine advisory panel, as I understand it, that has just voted to remove the recommendation that all newborn infants receive the Hep B vaccine. Can you explain first just the significance of this, the knock-on impacts, and how do they possibly justify this decision?
Well, the vote itself does indeed, as you said, removes the recommendation for routinely giving all babies who at birth a birth dose of the hepatitis B vaccine. Since we rolled out this policy decades ago, it has been so effective, meaning the incidence of hepatitis B, but also the downstream complications of that, like liver cancer and death, have really improved for kids. And they're taking that away.
Okay, so can you tell me something? What did it do? Like if your mom had hepatitis B when you were born, or how does it protect kids?
Right. So the vaccine itself, it works like this. So if a mother has hepatitis B, it's very easy for that virus to be transmitted to the infant after birth even, right? So if the mom is positive, you absolutely need to give the baby the vaccine to prevent transmission. The issue is that the anti-vaxxer contingent, the way that they're attacking this is to say, is kind of drip by drip. They're saying, okay, actually, if we could just only vaccinate the people who are the moms who are known to be positive for hepatitis B, then we don't have to give it to everyone. We just can give it to the babies at risk. The problem with that is that it's actually hard to get all that testing done. We don't routinely test. And people could occasionally have false negative tests, or they could get tested, acquire the virus, and then it's too late. On top of that, babies go home and they can get it from within the household from others.
Right.
So the idea that just because the mother doesn't have a documented hepatitis B infection, that means the baby is safe is not adequate. It's probably better than nothing. It's decent information to have, but it's not. It doesn't actually protect enough babies.
And explain to folks the reason this matters, because they didn't say you can't get the vaccine. They're just saying we're not urging every single parent to get their newborn vaccinated. How does that small change have a massive ripple effect?
Because pediatricians and people working at hospitals, they have to make quick decisions about what to do. And you can't go through every single thing you're going to do and talk about it like it's a Supreme Court issue. You have to say, okay, look, this is settled science. We're doing these things. If you have questions, we're happy to answer them. But what this does is this sort of slows things down, and it makes it really hard for the clinicians to get everything done. And what we know what will happen is that fewer babies will get this birth dose. And the implications there are massive. I mean, look, there are people who die later on because they didn't have a birth dose of this vaccine. So the other issue is this idea when this. I just want to back up and say the reason this happens is not random. This particular advisory committee, this is the CDC's ACIP, the Advisory Committee on Immunization Practices. Sounds like a committee, and committees do what they do. But actually, this committee has real legal teeth because under the Affordable Care Act and some other laws that came after, the recommendations that this committee makes, once adopted by the CDC director, become our national policy. And the reason that matters is, okay, who cares? That's just our national policy. But by law, those national policies apply to private insurers because of the Affordable Care Act. So if I say if the ACIP committee says we recommend all babies get vaccinated against hepatitis B at the time of birth, that recommendation is not only just, oh, the CDC says so, and we should do it, so clinicians and parents will be confident in that information. It's legally binding that the insurers have to cover it.
So without this ruling, it means insurance can choose not to cover it, which makes it out of reach to a lot of people based on their income.
So it really would depend on how it's interpreted, right? So if this whole other question about like individual-based decision-making, which is what they're invoking, they're saying that they recommend individual-based decision-making. And when it's sort of in this optional kind of way, we're not really sure, right? Because the insurance companies could say, oh, well, you said it's kind of a choice and sounds like it's a choice for them. So could it be a choice for us? And I don't necessarily think that the insurance companies are going to act on this now, but I think that over time they might. And it really does also put, there's questions of liability because again, if you do something and the downstream consequences, if you can go back and say, look, the CDC's advisory committee said that this is like what we should do because the risks are so much smaller than the benefits, then you're in really good shape. So this really undermines people's confidence in this vaccine, which again has just been a success, a huge success.
Let me just ask you to a bottom line this part of it. Is there any evidence that the vaccine, while successful for many people, is actually detrimental and dangerous in the ways RFK claims for others?
No, this is a very safe vaccine. And I will just caveat that by saying there's no such thing as a medical intervention that doesn't carry some small risk. That just doesn't exist. And so therefore, if there were no benefit, you'd say, oh, okay, well, what's the risk and why are we doing it? But the benefit is real disease, lives saved, liver disease. Yeah. And so what we heard at the CDC's meeting was a lot of stuff out of the anti-vaxxer playbook. We heard parents giving us anecdotes saying that their kid got a vaccine and then the kid died. I mean, again, first of all, that's just an anecdote. I have no idea if that's what happened. And on the other hand, it's a tragic story. You hear this father talking and your heart goes out to him because he lost a child. I don't necessarily know if he lost a child for the reason he states. Right. But on the other hand, it's perfectly possible that that tragedy is real. I don't know. But what I do know is that if you've saved 1,000 lives or 10,000 lives or 100,000 lives and you caused harm in a few, that is tragic. But that doesn't mean we should stop the program because we'd much rather have fewer deaths than more. And so that's really what we're dealing with.
Let's talk about what happened with the COVID vaccine this week, because it's not this vaccine, assault on vaccines is not particular to one vaccine. So what's going on with COVID vaccines?
So right now, the COVID vaccine story has a couple of different threads. The first thread really came earlier in the year when RFK unilaterally just told the CDC to change their recommendations. In other words, without having the usual committee to go through this. The irony is a lot of the things that he wanted to do were things that the previous iteration of the committee, which was a group of truly respected experts,
they were actual scientists.
Yeah, they were leaning towards a lot of this. So that was the first thing. But then the FDA kind of got involved really over there outside of their scope. The FDA is supposed to say, is it safe and effective? the FDA started to get into the weeds on, maybe we should limit who it's licensed for or who it's approved for to high risk groups. And the data really for that aren't that clear. So they've been really opaque about this. So that leads to this ongoing sort of attack on COVID vaccinations as something that people should get. And while I will say I'm sort of sympathetic to the idea that in the year 2025 and year 2026, we can modify some of our recommendations. The way they're doing this has been unilateral without showing their work and to really scare people. And that comes to what I think you're asking about, which is that the FDA sort of announced, or through media stories we learned, that the head of the head of vaccines at the FDA has concluded that the pediatric COVID vaccine is, quote unquote, responsible for potentially 10 deaths in kids. And I don't know if that's true. We just have not seen the work.
Yeah, because part of what's happening is they're like not sharing data, and we don't actually have the information that they're basing all this stuff on. I want to actually, if I can get my phone back on because I turned it off, but read to you from somebody who wrote into me saying, I'm going to tell you in short, that she went to get her kids a COVID vaccine and was told she is going to have to pay out of pocket $400 or $500 for it,
Wow.
and can't afford it. And said, they're saying they're making this optional, but now they really are not, because that's not an option for me. Have you heard stories like that?
So I've heard some people hearing things like, my doctor told me it might not be covered, which is different than it being rejected and then they having to pay $500. I think that some clinicians have been telling their patients, we don't know if it's going to be covered. And then that's leading patients to say, I don't want to risk that. As opposed to actually it might have been covered, but they didn't know that.
I'm trying to find this as we're talking. Anyway, I'll come back to it. I'll send it
But
to you later.
what I'll say is, like, this is exactly the point, is that the administration, the people in the FDA and the CDC, they sort of frame this in this way that sounds like they're trying to do vaccines a favor. Like they're trying
Right.
to restore trust in vaccines by making it by emphasizing in their recommendations things like shared decision making between the doctor and the patient, or quote unquote informed consent, as though we don't already tell patients about that tacitly and directly. So what they're doing is they're sowing this mistrust, and then they're doing two things. One, they're saying, boy, the public doesn't trust these COVID vaccines. And we're like, yeah, that's your fault. But the other thing that they're doing is they are very, very selectively focusing on some of the risks, which I think they're overblowing. And they're brushing under the table all the benefits. And that's a choice that they're making. And it tells me about what they're up to. And it's not surprising, because the people doing this have a personal vested interest in that, because they are people who have conscience. They're not psychopaths. Okay. Just like they're people who, they wake up in the morning and they don't want to harm people. But these individuals they don't want to harm people. They wake up in the morning, but these people have been saying for 3-4 years now that they think that the COVID vaccine isn't really useful for kids. Well, imagine if it is. That's on their conscience. That's on their rap sheet. Like if you said, hey, don't get a primary series if you're a kid, and I tell you that decision cost 1,000 lives, you feel pretty bad about yourself for saying that in public, which is what they did. So they're very eager to find evidence that it kills a couple kids, because then they can sleep at night.
Right. And we should just set the baseline here, which is that when RFK was confirmed before the US Senate, he vowed over and over and over that despite his history as a vaccine, the polite term is skeptic, the accurate term is conspiracy theorist.
Yeah.
That he would not use the position he as HHS director to in any way impact access to vaccines. And he has lied about it at every turn. We've seen him attack vaccines one after another, and roll back policies. So it is having the practical effect of denying access to vaccines to more people. Is that fair?
That is completely fair. And the center of that story is not just RFK, but it's Senator Bill Cassidy of Louisiana, because Senator Cassidy, a physician, is the head of the committee that was responsible for RFK being confirmed. And RFK made empty promises to Cassidy. Cassidy was very worried about this, and he believed RFK, and he's paying the consequence, and therefore our children are. I will say, I think that Senator Cassidy has shown since that vote that he recognizes what a terrible, terrible mistake he made. And I think that's why, for example, the CDC, the initial pick for CDC, Dave Weldon, was yanked in March from consideration because I think that Cassidy said, nope, I'm not going to rubber stamp anyone anymore who has a vaccine record that isn't flawless. And that's how we led to the shenanigans at the CDC that we've seen up till now, which is they replaced that pick with another. That pick, Susan Manarez, was fired because she too stood up for vaccines. And now they put in a guy called Jim O'Neill, who's not a scientist, not a physician, doesn't have any idea what how any of this works. And he's running the CDC. And now RFK can do whatever he wants.
Yeah. So let's talk about some of the other staff changes and the CDC more broadly. They have a new deputy director, Dr. I think Ralph Lee Abraham. I think he was Louisiana's Surgeon General. Why don't you tell us a little bit about him and his record?
Yeah, so this is a story that I actually broke in Inside Medicine. And the way it works is this. At the CDC, you've got the director. And then you have the next in charge, the principal deputy director. The principal deputy director is usually a career scientist from the agency who's been there for a long time, knows the place inside and out. If you're the new director coming in and maybe you've never served at the CDC or maybe you served there years ago, that principal deputy director is your brain. They are your right-hand person.
Oh.
And the previous principal deputy director was Dr. Deborah Howery, who resigned in August in protest when Susan Manarez was fired for standing up to RFK for vaccines. So in this particular moment, not only is the principal deputy director at CDC usually important, it's even more important because the acting director right now is somebody with absolutely zero qualifications to run the place. So that means that this person, Dr. Abraham, is ostensibly the real decision maker, because then he can tell his boss, this Trump MAGA guy, what to do.
And
you want to know about his beliefs?
Yes.
So Dr. Abraham, as you correctly stated, was up until recently the Surgeon General of Louisiana, and he has a track record which should concern us. First of all, he really auditioned for something in the administration. The minute that RFK was confirmed, he was out there saying, hey, here in Louisiana, we're going to stop our media campaigns for vaccinations. He still said things like, oh, vaccines are important, but we're not going to promote them. During the pandemic, he was very, very busy prescribing ivermectin for COVID, which, despite it being a nice idea, just unfortunately doesn't treat COVID the way that people who believe in some conspiracy theories seem to think it does. And not only that, he was the 7th leading prescriber of ivermectin in the entire state of Louisiana during 2021. So of 12,000 doctors in Louisiana, he was number 7. He prescribed it over 400 times. And he actually personally was responsible for over 1% of the entire state's ivermectin prescriptions during that year.
Wow.
And it gets worse.
Amazing.
It gets worse.
He's like Joe Rogan's favorite doctor then?
So, I mean, he is, I'll put it this way, he's not an effective public health advocate.
Yeah.
There's been whooping cough outbreaks, and he sat on that and was criticized for not letting clinicians know about this. During the opioid epidemic, he was very slow to realize that overprescribing was a problem. He was a lead prescriber for opioids way after we understood that we had, the pendulum had gone too far. So
I feel like we could do a whole conversation on him, but I want to make sure we're covering enough of the amazing different news you've covered. So for folks who want to learn more, check out Inside Medicine on that one. I want to ask you now about what's going on with grant making at the CDC, because this is another crisis/scandal. Tell us how grants work, why they matter, and what's happening.
Yeah. So grants, first of all, usually when we talk about grants, we're talking about the NIH, the National Institutes of Health. But the CDC also has grants. And I wrote a really long story. It's a deep dive discussing what happened at the CDC this year with their grants. And it's, I think, a really important microcosm for what is happening, which is that DOGE came in and they said, you can't do your usual work. You can't get the expertise that you need, because the CDC scientists, they decide who gets these grants. But they can't just decide willy-nilly. They have to actually get expert advice. So they get permission through charters that are required by federal law to convene these panels of experts who then adjudicate the different proposals. DOJ and the Trump administration said you can't convene those. And so the CDC scientists were like, we have to get hundreds of millions of dollars of grant funding out the door. How are we going to do that? And my story was about a group of scientists at the CDC who looked in the fine print and found a way. And not only did they do that, they convinced their leaders that it was okay. And ultimately, DOJ at the very last minute just rubber stamped everything, and they let them do it. And we're not sure why that happened, except that we think that the administration is following the law when it comes to this idea of the spend. Congress tells them you've got to spend money, and if they don't, they're violating they're violating the law that Congress says you got to spend money.
And these are legit committees and panels, and they're not just funneling the grants to Trump allies and, business associates.
So right up until now, up until this year, it's just been the way it works at CDC is the CDC actually sends out what's called notices saying, hey, we have some research questions that we can't answer. Would anyone like to help us? And then people submit their proposals. And that's a little different than the NIH, but I won't get into the weeds. Up till now, the CDC scientists have used these external experts who are vetted to make these calls. But there are new rules coming online that are saying, hey, you know what? These grants could be decided by a political appointee. No big deal. We thought that maybe that's what would happen this year. But instead, they let the CDC scientists actually do it the right way. And it was quite heroic. But what I'm worried about is they did that just to sort of sign the paperwork on 2025. And that way, with 2026 fiscal year coming, they could say, great, we took care of 2025. Any lawsuits about that are now moot. And we can have fun with 2026 dollars. So we don't know how that money is going to be spent. But just very easily now with the new rules, the CDC, instead of saying we're going to have a competitive grant process that's transparent, they could just say, yeah, we're going to give it to the scientists that RFK likes.
Yeah. There's so much going on. We're friends, and sometimes I text you and ask how you're doing, and you're like, not great. This is very bad. Can you give us more broadly, we talked about some specifics, a broader sense of what is happening inside the scientific community? What is the mood of people who do the kind of research that brings us medical breakthroughs? And what kind of long-term impact do you think the changes this year are going to have?
The long-term impact is going to be incredibly terrible, but it's going to take time for that to vest, because you don't know if you fired a bunch of scientists or canceled a bunch of grants for a bunch of viruses that we've never heard of, maybe 20, 30 viruses that you've never heard of. And in 5 years from now, one of those causes a pandemic. We're going to wish we'd funded all 20 so that we knew something about the one that caused a problem. And so it's the problem is that, like right now, if I said, hey, everyone, we're taking seatbelts out of cars tomorrow, we'd see the death rate go up immediately, right? Because seatbelts save lives every day. But a lot of this stuff is going to take a long time to kind of catch up. And as many people have said, the proof is just going to be in statistics like, oh, look, our pediatric death rate went up. Oh, look, we're having more measles outbreaks. But by then, it's kind of too late, but hopefully we can respond. I think that the mood is that we've lost our edge scientifically. People are leaving. Scientists are leaving. They're not, we have a brain drain.
That's really happening.
Oh, I know one person who already, really smart PhD, who took a job in Toronto and turned down a job at a really great US university. We lost that guy. And people are talking very seriously about where the future of science is, and they're worried it's not here. So I think that's going to end up affecting people in ways that they can't necessarily always perceive. 10 years from now, if your relative is dying of cancer, and in the counterfactual universe, sliding door universe, some research that we are funding today leads to a breakthrough in 5 years that keeps that person alive for 2 years and feeling good, we'll never know that. And so it's so hard because it's a hypothetical, but no one's going to know that part. They're going to know when they see pediatric death rates go up.
Can you help me with this part of it? Because Trump is surrounded by businessmen, people who are startup gurus, VCs, investors, who are all about innovation and the next breakthrough. Many of them are heavy investors in the biomedical space, which I understand has completely collapsed as an investment space since RFK came in. How do you square all this in your minds? What do you think is the motivation of this administration that supposedly cares about business innovation and there's a ton of at least money to be made on medical breakthroughs, why pull the rug out?
Well, I think that they think that they can identify a smaller number of grant recipients who can do this work, who align with their values. They think that you shouldn't give money to big time universities to do scientific research because if you do that, you're going to progress the wokeism that is leading to our society falling apart. And so they think they're saving society by saying, look, we're not going to give money to Harvard and we're not going to give money to Columbia. We'll give it to our friends who think that January 6th was a little social gathering, who think the election was stolen, who think that vaccines cause autism, and then they'll solve the problems. And then, oh, by the way, like we'll probably go on their boards and we'll get rich later.
But I've also talked to sort of sophisticated biomedical dude, right? Startup dudes who are talking about the fact that this administration is allowing them to sort of test their new stuff on the public more quickly, and that this in itself will lead to innovation and breakthroughs.
Mm-hmm.
What do you say to that?
So I will say that there's some changes at the FDA. The FDA's mandate is to make sure that everything that gets to market is safe and effective. So you have to be effective and safe. And what I will say is that they are making, like we just heard yesterday, that they're talking about making it a little bit less difficult for some things to reach market. Hey, in some cases, ground truth, that could lead to something that helps getting to market sooner. But I think at the expense of safety. We have seen drugs and products that we thought were safe, even with the current framework in place, that turned out to be not safe enough because once it was put out, not in trials, you had thousands of people, but once it was given to hundreds of thousands of people, we saw, it's causing a real problem here, or over a longer period of time than the trial could show, we're seeing problems. So I agree that if you had a crystal ball to say, oh, this is a safe one, great, let's get it out tomorrow, then that kind of framework would get things to us faster. The problem is it comes at the expense of safety. And many, many times we have been burned by this. And so I personally would rather have a slightly slower deliberative process so that I can say to my patients, look, best we know right now, this is safe and effective, and the safety profile is at a certain standard. So I really worry about getting things to market just a little sooner in exchange for the safety. And also, when that happens, by the way, Jess, I mean, public confidence in
Trump plummets.
it plummets, yeah. And we
I
need
mean, the irony is so obvious. We started our conversation with a discussion of a panel removing a recommendation around vaccines because in some small cases it might have a deleterious impact, and on the other hand but the science around it is settled, and then on the other hand the FDA is allowing people to speed to market completely untested things to trial them on us on guinea pigs, it sounds like.
Yeah, and I really think that people look, when you're looking at safety and efficacy and risks and benefits, I think most people would agree with my assessment, which is safety first, folks. Safety first.
Okay, I want to ask you two more things before we wrap up and let you bring up anything else you think we need to know about. One is the impact on women's health and maternal health in particular. There have been so many changes with post Dobbs and then with this administration. There were all these warnings that women's health would suffer. Are we seeing that?
So I think that we're seeing confusion. I think we're seeing access, be on the table. Look, for example, mifepristone. This is a drug that helps with elective terminations. They're taking a shot at that. We don't know what they're going to do. Clearly, post Dobbs, a lot of states have enacted different rules. I would say that there's already data out there that shows that in the states that rolled that out, particularly Texas, the infant mortality has gone up because you didn't pick up these prenatal screens that were part of maternal care that would say, oh, this is a tragic case, it's not going to work. But
what you're saying is not because of mifepristone, but because abortion access has been eliminated, there's more infant deaths. Infants that shouldn't have come to birth maybe are being born and now die.
Correct. And what's really, sort of an open question is the effect on women's health themselves. I think that, I was someone who said, look, when Roe became the law of the land in 72, 73, there was a pretty precipitous drop in maternal mortality right around that time, which you could, guess might be related to people not having back alley abortions, but it's harder to prove that, but it looks pretty good. I was sort of concerned that we'd see a little bit of a reversal of that. And to some extent, I think we have not seen that, thankfully, because in the 1980s, the federal laws changed. So we have something called EMTALA, which says that we in the ER have to treat anyone who comes in no matter what. And so maybe these people who back in the day would have felt like, oh, if I go to a hospital in Texas in 1971 with a fetus that I'm not supposed to have because I'm single teen mom, today they know they can come to the ER and we will give them the care that they need, and that's true everywhere. Now, if people don't feel that way, if they feel like they can't go in, if they feel like ICE is hanging around and they're a person who they're worried about their immigration status, then we would absolutely begin to see that, and I worry about it. What I will say is the data has not shown that on a systemic level yet.
Interesting. There are political threats to, I thought it was pronounced EMTLA, but you said MTLA.
EMTALA.
EMTALA, okay. But there are political threats. There are some states where they are trying to roll back those rules. And AP has done some reports on places where women were denied that care, but you're saying broadly speaking, it's still in place.
Yes.
Okay. What advice would you give to people listening to this who want to keep themselves healthy and strong and safe and just feel panicked that they can't trust our health authorities right now?
It's so tragic that we don't have a central place to go, because the CDC, for example, I didn't agree with everything they always said, but basically, if they said something up until this year, you could bank on the fact that they were either right or close to right, and that there might be some nuance. Okay. Nowadays, when the CDC releases some communique, I have to read it and decide, wait, was this written by a CDC career scientist who's hanging on for dear life, and this is actually normal CDC kind of stuff? Or is this RFK driven drivel? And so people don't know. And so that's what's making this hard. A lot of groups are trying to step up. There are different projects trying to give recommendations. And I don't have an answer. I mean, you could go to the internet's Wayback Machine and look at CDC in 2024, but that's pretty work intensive and a lot of clicks to get to what you need. We're going to have a divide in this country, and people who come to docs like in my community and to me are going to get the evidence-based standard of care that we understand. And we'll be relying on our own view of the data. We'll be relying on things that come out of the American Academy of Pediatrics or the American College of Obstetrics and Gynecology, like really great groups that we trust. And then there are going to be people who say, hey, look, the CDC advisory committee just said that we really don't need to give the hepatitis B vaccine to every baby. And they are going to be the ones whose kids not only are higher risk, but who, because of that loss of immunity in the community, that rates will go up for everybody. So I think that that's where we're headed.
I have to say, this is a reason that your work has never been more important. And this is one reason anybody who is in my community or listening to this would be well served to follow you, to read what you have to say, and to reach out, because he's actually good at giving advice and answering questions. I wish we had institutional authorities we could trust. But in the absence of that, bless you for the work you're doing. And by the way, I really do like the beard.
Oh. It's controversial.
Is it staying?
Don't know. I don't know.
Okay. Well,
it's controversial.
That's up here. I'm sure it is. Is there any topic that you think we need to address, people must know about, that we haven't discussed?
Everything we've talked about actually is circulating around one bigger thing, which I do want to end with. Okay. And that is that Secretary Kennedy has come in, and they know that this is their chance to do decades worth of hobby horse work that they have. And they're doing that by actually turning away from science, turning away from evidence, turning away from frameworks that say, hey, if we're going to assess this question, how do we know of these 100 papers on the topic, which 10 are good and which 90 were, or which 85 were not so good, and which 5 were, quite frankly, fraudulent and terrible? And they're turning away from that scientific process that the public didn't even know they relied upon for the best science and medicine to reach us. And Kennedy is replacing that with his cronies, with his friends who see the world as he does, which is a world in which vaccines cause more harm than they cause a benefit, a world in which he's not sure if HIV didn't come from a laboratory, a world in which he thinks that the way to get out of a pandemic is for everyone to not be obese. great. I applaud
But
the
he
idea.
doesn't back GLP-1s.
Right. I applaud the idea that we should be healthier, but that's not a pandemic plan. So what I want people to know is that at the center of this is a person who is taking away the evidence-based science that we have all just blissfully relied on unknowingly. It's the infrastructure you don't know. It's the potholes that get filled and you don't know they were there because the road work was done. And over time, we will begin to sense the consequences of that. But this man is a true menace to our public health, and he should resign or be fired.
Thank you for putting it so plainly. To anybody who doesn't already know this, his newsletter again is Inside Medicine. You can also follow MedPage Today, where you have an important voice and role, and check out his social media. And Dr. Foust, thank you so much for your time and your work. Please take a vacation.
You too, Jessica Yellen, because you're like you are one of the few people who's willing to go out there and take nuance and complex things and talk us off of cliffs when we need to be and tell us where the cliffs are because they are around us.
They're everywhere. It's so great to see you. And let's do this again soon in the new year.
Sounds good. Thanks.